Dr. Deom here, Hazleton Eye Specialist and Stroudsburg Eye Specialist. Welcome to another episode of Eyecare Today. And yes, I think I'm cool because I'm wearing sunglasses inside. These are actually eye protection for my very new special friend here, M22. Not R2D2, M22 Intense Pulse Light Treatment. We are very excited here at Hazleton and Stroudsburg Eye Specialists to be the first to offer Intense Pulse Light Treatment for dry eye, specifically meibomian gland dysfunction. So I'm really excited to tell you a little bit about it. We're actually going to show you a live treatment to let you know exactly what it's like to have intense pulse light treatment. We expect there to be lots of questions. This is something that's very new to Eyecare and is something that is very new to our area. We're the only ones to offer this. So if you have a question, we are Hazleton Eye Specialists. We're located on the Airport Beltway in Hazleton, right next to the Big Eyeball. So if you're driving down the Airport Beltway in Hazel Township, you'll see the Big Eyeball on the front of the Franklin Corporate Plaza. It's 280 Airport Road, Hazel Township, PA. Telephone number is 5704-532020. We are also in Tannersville. Right behind the Friendlies in Tannersville, Stroudsburg Eye Specialist, brand new, beautiful location. That's 2943 Route 611, Suite 5, Tannersville. Telephone number there is 570-421-3342. So we're here today to talk a little bit about dry eye. And if you drive past either one of our offices, you will see a big billboard that says the Dry Eye Center of Northeastern Pennsylvania. And I joke, but it's true. This practice is really the practice that dry eye built by way of Dr. Thomas Kislin. This is a passion that he has had since day one building this practice. It is a passion that he has taken to the next level with every introduction of technology that has been available throughout the years. All the way from, the outset of treating dry eye, which was basically warm compresses and scrubbing your eyes with baby shampoo, to now utilizing unique technologies like the device sitting next to me. So what I'd like to do is just do a little synopsis on dry eye. So first of all, when we think about dry eye, we often think about symptoms. Itching, burning, scratching, tearing. So if you're noticing any of those things, it's likely that you have dry eye. Number two is visibility. So in other words, oftentimes your eyes look irritated. It could be your eyeball that looks red, pink, or inflamed, or it could be your eyelids that look red, pink, or irritated. If you're noticing that, then you may also have dry eye. Lastly, what people don't always think of when it comes to dry eye is vision deficiencies. So what does that mean? What that means is if you have vision that does not seem to be as good as it once was, there may be a deficiency in your tears. The other thing is that oftentimes people notice that their vision changes, it fluctuates. Sometimes it's clear, sometimes it's blurry. That is a hallmark sign of dry eye also, intermittent visual blurriness. So let's dive into the treatments. We know that dry eye is an inflammatory process. What that means is that there is inflammation in the tears and on the surface of the eye that decreases the quality of the components that make up a good quality tear. There's really three things that make up a good quality tear. That's oil. They come from the glands in your eyelids, and I'm showing you a diagram now of the three-layered tear and the components of the tear. So the oil, which comes from the oil glands that you can see, the water that comes from the water-producing gland called the lacrimal gland located above the eye, and the mucus that is produced by a one-cell gland called the goblet cell embedded in the cornea and the conjunctiva. So those three areas produce the three parts of the tear. The real important part of the tear that we want to focus on today is the oil part. And the oil part comes from the meibomian glands. That oil gland and the oil part is important because it keeps the tears on the eye. If we don't have the oil layer, then the tears evaporate. And one of the hallmark signs of evaporative tear dysfunction is excessive tearing. And the reason for that is if the tears evaporate, the cornea, the front part of our eye, feels dry, and that signals a reflex to the lacrimal gland to produce water tears. And so we get this excessive watering that creates a watery tears. And that is really a hallmark sign of evaporative tear dysfunction. The hallmark treatment that we had for that was topical anti-inflammatories. That could be Restasis, it could be Xiidra, it could be Cequa, it could be some of the oral omega-3s that are producing good healthy fats in our body, which the oil layer is a good healthy fat. So those are supportive introductory treatments. If we see that patients are still having a difficult time with that type of approach, a topical anti-inflammatory approach, and also warm compresses, then we might recommend an advanced treatment. Some of the advanced treatments we've had to date are LipiFlow, which is a thermal heat treatment that pulses the oil glands and gets rid of the oils. Here's a picture of LipiFlow. And then another treatment we had was MeiboFlow, which is a treatment that is also based in heat. So now we have IPL. And what IPL is intense pulse light. And what it does is it creates an anti-inflammatory treatment in the area where we're seeing this inflammation of the eyelids. And really one of the hallmark signs that we see are the red swollen eyelids. That's what we're really looking for. This is a treatment, again, that's been in many dermatology offices for years to treat rosacea. Rosacea is an inflammatory condition of the skin that can decrease the quality of the oil glands in the skin. And so what we see is for folks that have topical or facial rosacea, they also have a high incidence of ocular rosacea, which is simply rosacea on the eyelids. So we're seeing that rosacea in the eyelids actually decreases the quality of the oil coming from those meibomian glands, which I was talking to you about, and creates dryness. So what this light does, it is sent into the skin in a very specific area. We're going to show you in a treatment, right in this area, from this part of the face to this part of the face over the nose. And the reason why we do that is because that vascular supply supports the eyelids. Secondarily, it's done on the upper lid and the lower lid. And so the light is absorbed by the swollen, dilated blood vessels in the skin in that area. Those swollen, dilated blood vessels take up space where the oil glands are. And so they can push the glands and decrease the oil that comes out onto the eye from a space perspective. And then the other thing is those dilated blood vessels are also leaking inflammatory mediators into the tissue, which decrease the quality of the oil glands. All of these things, decreasing the quality of the oil glands, decreasing the flow of oil out of the oil glands, seeing the redness in the lids, basically can cause permanent damage or atrophy of the oil glands, where it makes it impossible to have oil moving forward. So really we want to try and be preventative and prophylactic in our treatment. So, you know, it may be that we recommend this earlier than what you would possibly think when in fact you aren't that symptomatic, because we're trying to prevent damage down the line. When we come back from a very short break, we are going to review a little bit more about IPL, and we're actually going to show you what it's like on a real live patient. So we've had the IPL for a short period of time. We've been lucky to treat a number of patients, and I have a patient lined up today who's going to be getting their second treatment. So on the other side of this break, we're going to take a look at a real life intense pulse light treatment for the treatment of meibomian gland dysfunction. Thank you, and we'll see you in a minute. Everybody, welcome back. This is Dr. James Deom calling today from our exam room. And we are on, of course, Eyecare today. You know, we're here in our Hazleton office on Airport Beltway by the Big Eyeball. On the Airport Beltway. It is 280 Airport Road, Hazel Township, PA 18202. Telephone number here is 570-453-2020. Give us a call. Of course, you know we're also in Tannersville at Route 611 and right behind the Friendlies on Route 611. Beautiful new location. Check it out. 570-421-3342 in Tannersville. So we are so excited. I got my special protective eyewear on. I'm going to take them off for just a minute to talk to you a little bit more about IPL, or intense pulse light treatment, the newest treatment that we have here at Hazleton Eye Specialist, Stroudsburg Eye Specialist, the Dry Eye Center of Northeastern Pennsylvania. We're very excited to be the first ones in the area to bring this to you. So this is a new treatment. We've talked about it quite extensively already on the show today. It is for the treatment of dry eye, and in particular meibomian gland dysfunction. That is the gland that produces the oil part of your tears. And so very important, the oil part of your tears. As we said, it keeps the tears on your eyes, stops the tears from evaporating. One of the main things that people notice when they have oil deficient tears is excessive tearing, watering of the eyes. And so many people come in and say, well, I have watering of the eyes. How could I have dry eye? Well, this is why. So the reason that this machine works is because it uses a special wavelength of light. Very important. It is a light. To essentially create a decreased amount of inflammation in the area around the eye and on the eyelids. So the reason why this is helpful is because it gets rid of those blood vessels, allowing for more space for the oil glands to secrete their oil, number one. And number two, it actually superheats the tissue to allow the oils to melt and come out better onto the eye. So that's what we do here. We use this device, this handpiece. It's got a sapphire crystal tip. If you touch it, it's extremely cold, but you can touch it. And what that does is just provides a more calming, cooling, comforting experience. You've had this done once before, and was it painful? No, it's not painful, and we're able to adjust the settings so that it is a comfortable experience. Important to know, not one treatment is a cure. It's actually not a cure at all. It's a controlling condition, because this is a condition that's chronic, dry eye. So, you know, this is something that we do 4 treatments over the course of, separate the treatments by about 2 to 3 weeks, and 4 treatments to get started. And we've seen, and there are studies that show dramatic benefits by doing this. And so we've treated a number of patients in the short period of time that we've had IPL in the office with very great success. It has been used in dermatology offices for probably around 20 years for the treatment of ocular rosacea, and the removal of pigmented spots on the skin. You might have even seen it used in certain offices for something called a photofacial or photo rejuvenation. But for the uses of us in this office, we're using it for dry eye and the treatment of meibomian gland dysfunction. Very exciting. So we have our patient here. She's actually done 1 treatment already. So we're just going to walk you through the process. What we're going to do is we're going to place some protective eye shields on the patient so that she can, you know, make sure that she has a protection so that nothing occurs negatively to the front surface of the eye. By and large, it's a very safe procedure, but we want to protect the eyeball and its contents. First thing we do is we place a anesthetic eye drop in. So tilt your head back, look straight up to the ceiling. Good. And so we place 1 drop in each eye. Wonderful. And so that's just going to numb the eye. Then what we like to do is give another artificial tear drop to lubricate the front surface of the eye, because this is a treatment that takes approximately 10 minutes. So we want to make sure that you know, we have that going. So we're going to go ahead and place the protective laser grade shield onto the eyeball. So the way that we're going to do that is we're going to have her look straight up to the ceiling, then look down, and then we're going to place this right under her eyelid. Is that uncomfortable at all?
No.
No, she said no. Good, look up. Good, and we're going to place that on. Good, just relax. Is that uncomfortable at all? No, it kind of looks weird. It's like you have a nail in your eye, but I promise there's no nail in your eye. Look down to the floor. Good. Good. And look up. Good. Wonderful. Good. So now we have the protective eyewear on. Next thing we do is we use a coupling gel specifically made for IPL or intense pulse light. We paste that on the area to be treated, which is on the nose, right beneath the eye, on the eyelid. Okay, so we just kind of paint the face with the IPL gel, and then we'll rub it in, make sure we've gotten the area that needs to be treated. So you can see we have the gel on the face, and I'm just going to use a glove to just kind of rub that in, make sure we have good coverage throughout here. We always want to make sure the patient's gotten any makeup off of their face that they might have, or creams. You don't have any of that on, do you, patient?
No.
No, good. Good. So we do, you know, this area of the face right here is called the tragus, and so we treat from tragus to tragus over the nose, and that's what's been shown to be beneficial for the treatment of meibomian gland dysfunction by a very famous doctor by the name of Rolando Toyos out of Tennessee. He's been doing this treatment for 10 to 15 years in his office. He was treating patients for rosacea and saw that they had dramatic improvements in their dry eye as he treated them for IPL. And so now what we're going to do is we're going to go ahead and get ready to do this. So I'm going to put some protective gloves on and put protective eyewear on, and we will go ahead and start the treatment. It is a bright flash of light. That's pretty much all you'll see at home. The magic is happening in the skin, where the absorption of the light is changing you know, the release of the inflammatory mediators that can affect the meibomian glands in a negative way. And so we're going to go ahead and get started here. I'll touch the tip here, make sure that we have the correct wavelength shield. Yes, we do. I'm going to put my protective eyewear on, make sure that my cameraman has his protective eyewear on. He does. I'm going to check everything again, make sure all the settings are normal. Good. And we're going to go ahead and start. So we're going to start right here on the tragus. And we're going to ask her, you know, does this feel comfortable or is it uncomfortable? We don't mind. We're always able to go down in the setting, and that's okay. So we're going to give her a countdown, 3, 2, 1. How did that feel? Was that okay? Good. So we'll continue. 3, 2, 1. 3, 2, 1. 3, 2, 1. Good. And what I always tell patients, gets a little spicier around the eyeballs and under the around the nose also. So look straight up to the ceiling for me. Just want to get that protective eye shield out of the way. 3, 2, 1. 3, 2, 1. 3, 2, 1. You can see it's a little sharper around the nose. Are you okay?
Yeah.
3, 2, 1. 3, 2, 1. 3, 2, 1. Look up. 3, 2, 1. 3, 2, 1. 3, 2, 1. 3, 2, 1. You can see she's a pro. She's only done this twice, so she's actually doing fantastic. You can see there's a little bit of flush on the skin after we do it. That's normal. A little bit of flush is normal. That tells us we had a good treatment. We want to make sure that we don't over-treat, so we always are talking to the patient. How does it feel? How does it feel? Kind of going from there. So we're going to, normally we do that twice, but I'm not going to do that right now. I'm going to show you how we treat the upper lids and lower lids, which is a newer application. So what we do is we remove the light guide and we take that off. It's very easy to do. Just needs a little. So we remove that and then we put in a smaller light guide. And I'll show you that in just 1 second here. Good. It snaps in. Change the wavelength. All right, so we're gonna go ahead and treat the lids. So you can see we have a smaller light guide. We're gonna place 2 applications on the upper lid and 2 applications on the lower lid, and we're gonna do that 2 times. So here we go. I'm gonna give her that countdown. 1, 2, 3. 1, 2, 3. Good. 1, 2, 3. 1, 2, 3. Good. Now I'm going to have her look straight up to the ceiling so I get that lower lid as good as we're able to. Good. So 1, 2, 3. 1, 2, 3. Good. Look straight up to the ceiling. 1, 2, 3. 1, 2, 3. Good. And we're going to do it one more time on the upper lids. 1, 2, 3. 1, 2, 3. Good. 1, 2, 3. 1, 2, 3. Good. So she did wonderful. How are you feeling? So we press standby so it doesn't come shine that light again in our exposed eyes. We're going to go ahead and take her laser shields off, even though this is not a laser. Look up. Good, it's very easy to get that off, not uncomfortable at all. Good, and then go ahead and look down again. Good, and we get that off. Very good. You still got eyeballs under there? Yeah. Perfect, wonderful. So we're gonna go ahead and wipe her face off, and you can see sometimes we notice some areas on the face where there was some pigment, where the pigment may be more noticeable after the treatment because the light could be absorbed by pigment in the skin. Sometimes some of that pigment disappears. It's not the intention of the treatment, but sometimes patients do notice that. But what we want to make sure of is that everything looks good and she's feeling comfortable, which she does. So what we'll do is we'll have her come back now in probably 2 to 3 weeks to redo this treatment. Again, it's 4 sessions separated by about 2 to 3 weeks. What we've seen has been very successful thus far. If you suffer from dry eye or meibomian gland dysfunction, in other words, if you ever have itchy, burny, scratchy, teary eyes, if you are ever noticing excessive tearing throughout the day, then you probably have meibomian gland dysfunction, and IPL is something that would work well for you. You could come in, we could do a consultation for you and determine whether or not you are in fact a candidate for IPL. Some other things that, some other classifications of individuals that it works very well for are individuals who suffer from facial rosacea. There's a high likelihood that you also have ocular rosacea, which is decreasing the quality of the glands in your eyelids. And so we can determine that here in the office and determine whether or not in fact IPL is a good treatment for you. We're very excited at Hazleton and Stroudsburg Eye Specialists again to be the first in the area to have intense pulse light treatment for the treatment of dry eye and meibomian gland dysfunction. If you're interested in anything we showed you here today, give us a call, 570-453-2020 to make your appointment, or 570-421-3342 for the appointment in Stroudsburg, our Tannersville location. Thank you and have a great day.